Can I start, sir?
Yes, we can start.
Good afternoon, everyone. I'm Dr. Kirti Soota, diabetologist at Dr. Makkar's Diabetes and Obesity Center. In today's session, we will be discussing about another very important topic. But yes, why is this topic so important? For most of us, driving is a very big part of life. Most people with diabetes can do it safely. But yes, there are a few things which should be kept in mind before one is behind wheels. How diabetes can affect life, how diabetes can affect driving. Like all other individuals with diabetes, can also take the pleasure of long drives, but with little preparations. So, what preparations are required before one goes for a long drive? And so many other questions. So, today we have Dr. Makkar with us to give answers to all of these questions. Good afternoon, sir.
Good afternoon, Dr. Kirti. Good afternoon, everyone on the other side of screen.
So, my first question to you is how can diabetes affect driving in diabetes patients?
See, this is one very important area where most of the people don't understand or don't know about it, and most of the times, unfortunately, physicians also don't discuss with their patients about the precautions related to driving. So, diabetes can affect driving in two ways. One, because of the diabetes medicines that person is taking, which can lead to low sugar levels, which can compromise driving very significantly. And second part is the complications of diabetes, which affect eyes, which affects feet, which affect nerves, which affect blood vessels. They can also lead to complications, physical limitations, which can compromise driving. So diabetes can affect driving, one because of the treatment that we are giving for diabetes, and second because of the complications that are related to diabetes.
So, sir, we would like to discuss both the points in details from you. Let's talk about the medication part. What are the medications that can affect driving? And what are the
So,
consequences?
so basically, we have to understand that whatever medication we are giving to a diabetes patient, the first goal is to lower the blood sugars, right? Because all diabetes patients, one of the major reasons, major concerns is the high blood sugars, and we have to lower those blood sugars. Now, important thing is that once we start lowering the blood sugar levels, there is risk of going too low, and that is called hypoglycemia. That so if it was, if it was just like that, you can bring down sugars as to whatever degree, there'll be no problem. Then there is no concern. But the important thing is that we have to keep the sugar levels in a desired range, which is neither too low nor too high, which is the normal physiological range of glucose levels. So we have to target a blood glucose range of 70 to 140 or 150 in most of the patients. Now, once we are bringing the sugar levels, every person with diabetes responds differently to the anti-diabetic medications. So somebody may get a sugar from 200 with just 1 milligram of a particular medication. The other may require 8 milligrams and still not be able to come down from 200, and you may need to add insulin also. So practically this, understanding should be there with every person with diabetes, that their sugar can go significantly low at any point of time during the course of life. And they should know what is to be done if they get low sugars or hypoglycemia. And we have already done, one full session on hypoglycemia and how to manage it. Now, not all medications push the sugar very low. Currently, fortunately, we have newer medications which don't bring down sugars to very low level. They bring down to normal, and below the, if once you have achieved the near normal glucose levels, then their efficacy becomes very low, and they don't push the sugar levels to very low levels. But the two potent medications, one is the sulfonylurea class, and that a person can know from his or her physician that whether he or she is being given a sulfonylurea medication or if somebody is on insulin. These two classes of drugs actually can bring down the sugar levels to serious low levels or very significant low levels, which can become dangerous. So these two classes of drugs are very important, and if they are on your anybody's prescription, one has to be, very cautious that one can get into very low sugar levels, which can become dangerous when they are driving. And they can become dangerous otherwise also, but driving gets affected very badly once you have low sugar levels.
So, what are the consequences of low sugars?
So what happens is once somebody gets very low sugar levels, that is defined as less than 70, the brain is totally dependent on glucose as fuel for brain's functioning. So there is clouding of brain's function. So person may get, drowsiness, person may become irritable, person may start feeling headache, person may start feeling tremors, increase, there because of this low glucose levels coming to blood, there is increase in sympathetic activity. So somebody may start feeling increase in pulse rate, palpitations, sweating, profuse sweating, feeling of, very excess hunger, that you feel like that if you are not going to get something to eat, you may, pass off. So all these things can happen. Now, one important, thing is that despite we educate our patients, good number of times they don't remember what are the symptoms of low blood sugar. So as a precaution, first thing every person with diabetes should understand that irrespective of whatever problem they have, if they feel something is wrong, first thing they should do is check their sugar. And if their sugar is less than 70, that is the cutoff for defining low blood sugar or hypoglycemia. They must immediately take some fast acting sugar or glucose or a liquid form of sugar like Coke or Pepsi or juice, which can bring up the sugar levels fast. And this should be equal to at least 15 to 20 grams of glucose, which makes it about 3 to 4 spoons of glucose or sugar, or about 100 to 150 ml of a sugar drink. That should be taken immediately. And within 15 minutes, after 15 minutes, one should check the sugar again. And if the sugar is not gone up, in fact, for most of our patients, we tell them that if you are driving, you should not have your sugar less than 90 at any point of time. So even if you, end up going a little low, you still have margin. And if your sugar are not above 90, then you repeat the in glucose or, soft drink. And once it goes above 90 and you start feeling better, then only you should drive. So it is very important to understand what are the symptoms of low sugar levels. But if you don't remember what are the symptoms, the basic principle is for any problem that is happening, that you feel that there is something wrong, first reaction should be to check blood sugar level.
And if you're not able to check your sugars, please eat something. That is why we
Yeah,
advise
so
our
if you are
patients.
not actually, another problem is in India, unfortunately, most of the people don't use glucometer regularly, and the carrying to office or carrying to workplace is totally, uh, I would say missing. May not more than 1%. I wouldn't say 1%, not more than 0.1% people carry their glucometers to their workplace or when they are traveling. So it is a basic tool that you should have in your carry bag or in your briefcase or in your backpack, so that anywhere you need to check your sugar, you should be able to check. Now, in the event that you feel that there is something wrong and you are not having your glucose meter and you don't have, a facility to get your sugar checked at the point where you are feeling problem, first thing is you consume sugar or glucose or a soft drink, presuming that it is low sugar.
Yes.
Never presume it is because of high sugar, because if it is high sugar, you are never going to have immediate problem. But if it is low sugar, it will cause immediate, crisis. So if you are not carrying a glucometer, you can't test your sugar, you are feeling something is wrong, first reaction should be to treat this as low sugar level or hypoglycemia.
For this reason, we tell our patients, please carry something to eat with you, like
Yes.
candies, glucose biscuits, fruity, etc. Whatever can be kept in the
Yeah.
dashboard of the car.
Best is if they carry glucose tablets. We get
Yeah.
glucose tablets in the chemist shops. So taking 3 to 4 tablets, they just chew it and it acts very fast. Or they should take a liquid, where it is dissolved. Sugar is in dissolved form and acts faster.
Yes. So, how can we prevent this situation of hypoglycemia, clouding of your thoughts, accident proneness? How can we prevent all these things?
Yeah. So what happens is, once I mentioned about the symptoms of low sugar or hypoglycemia, imagine if somebody is driving and starts getting low sugar. Now the brain functioning is going down. Person is getting into drowsiness, or there is a loss of response.
Yes.
Person may be seeing something on road but may not be able to respond quickly because the brain function is clear, and there may be clouding of consciousness, and if it is prolonged, person can fall unconscious while driving also. So all these things can lead to a very severe or bad accidents. So first thing is, if one is driving and gets any kind of problem, anything that person is feeling wrong, first thing is that turn your move your car to the car or vehicle, whatever you're driving, to the side, stop it and check your sugar. First thing is to stop driving. Immediately move to the safe side of the road and stop your vehicle. Now, before driving idly, you should always check your sugar before you start driving. Whether you're driving a two-wheeler or whether you're driving a four-wheeler, does not matter. And you make sure that your sugar is at least 90 or more. Second thing is, if you have taken your medication in the morning, then never leave your house till you have had your first meal. If you have taken sugar, and even if there is an emergency and you have not taken a meal, you may end up in another emergency because you have missed your meal and taken the medication. So in whatever event, if you have taken medication, just make sure that you have your meal and then only you start driving. Before driving, always check your sugar. Always carry some sweet or sweetened drink in your vehicle or in your backpack. Always carry your glucometer and strips with yourself. Don't leave them in the car because, in very hot weather or very cold weather, these instruments can get damaged. Then, slightest doubt, you must consume something, and always park your vehicle on one side. Don't drive till you are fully, conscious, fully oriented, and feel comfortable enough to drive. If you have slightest problem, don't continue with driving. That is very important.
So usually we encounter this problem कि डॉक्टर साहब बहुत जल्दी में थे, ऑफिस के लिए देर हो रही थी, दवाई खा ली and खाना नहीं खाया. So please be very careful. So one more thing which we were discussing today was the iCard. So I think this thing is also a must for the diabetic patients.
Yes, I think it is very important, but unfortunately in our setting, there is this, I would say, the culture of giving a patient ID card to diabetes patients or persons who have diabetes is virtually non-existent. And even we started in our setup, we started giving cards, but most of the people don't carry that card. Now, suppose a person becomes hypoglycemic and is not carrying sugar or sweetened drink. and becomes unconscious. These ID cards are very helpful, which mention that I am so and so and I have diabetes. If you find me unconscious, please give me some sugar sweet immediately, or take me to the nearest hospital, whatever. So those identity cards are very important thing, and they should be carried by diabetes persons.
So there is one more very important term, hypoglycemic unawareness, and which we talk of. So how can this term be a dangerous, can lead to a dangerous situation for patients with diabetes during driving?
Yeah. So it is again very important thing. The problem is when people have frequent fluctuations of sugar levels, and then they have frequent highs and frequent lows. Now, normally when the sugar levels are going low, I told you many symptoms that person will experience. Person will experience headache, tremors, sweating, palpitations, uneasiness, excess hunger, irritability. And if it persists for longer duration, person can feel drowsiness and become unconsciousness also. Person can have full-blown fits like, epilepsy. All these things can happen. So these symptoms happen once the sugar level starts going below 70, and as it goes down, the symptoms go on increasing. What happens is, if somebody gets frequent low sugar levels, then there is something called conditioning, or person gets, or the person's brain gets used to these frequent lows, and these symptoms stop appearing. And suddenly, once the sugar has gone too low, person becomes unconscious. Without this unconsciousness can happen without even getting any symptoms. And this can be very dangerous, because if you are having frequent lows and you are driving without checking your sugar, you will not get symptoms when you are going into low blood glucose levels. And you may suddenly fall unconscious while you are driving. So this can be dangerous. You can have bad accidents. It can be, life threatening. So these situations need to be avoided. Anybody who has frequent low sugar levels should not be driving. Should not be driving till the sugar levels are stabilized at the normal range, and person has been without low sugar levels for at least 4 to 6 weeks. Because if you bring them to higher levels of glucose and they don't go into low sugar levels for say a month or so, then the symptoms start appearing again.
So, what I could make out is, if a patient has hypoglycemic unawareness, means the sugar goes down without the warning signs,
Yes.
he or she should not drive without the permission of the doctor.
um Nobody asks for permission from doctor for driving.
But sir, how can one make it out?
Once,
Now I am able to drive.
yeah, so that's what I'm saying.
Yes.
So first thing is, if they are getting frequent lows, they must consult their physician.
Okay.
They get the medication and the diet readjusted so that their sugar levels stop dropping low. And they will know this only if they are regularly checking their blood sugar levels. And once they have been in the normal range without having any lows for at least a month, then the symptoms will start appearing, and then they get back to driving.
Right. So we all know diabetes affects our foot, eyes, nerves, and they lead to a lot of complications also. So now I would like you to enlighten us on how these complications affect driving. Let's talk about foot complications first.
So see, your half the controls of your vehicle are on your feet. Whether you are driving a two-wheeler or you are driving four-wheeler, it doesn't matter. So functioning of foot is very, very important. Normal functioning of feet is very important. Most common affection of feet is because of the damage to nerves of feet, and it is the nerves of feet that start getting damaged early in the course of disease. They are the first ones to get damaged, when person develops neuropathy. So once person starts developing neuropathy in feet, the foot architecture also starts changing. There can be clawing of foot, there can be, abnormal posturing of feet, and there is abnormal sensation in the foot. Now, these abnormal sensation may not allow you to feel the paddles properly, and your pressure on those paddles may be inappropriate. So you may end up having, difficulty in driving, or you may feel that you have already pressed the pedal, but you have not pressed, or you have pressed it too hard. All these things can lead to difficulty in driving and risk for accidents. So you have to make sure that you are getting your sugar controls are fine. If you have significant neuropathy, you are not able to sense the pedal. You may, try to brake, but you may be putting your foot on some other place, rather than the brake pedal. And since you can't feel it normally, you will not know what is happening. So abnormal sensation or loss of sensation becomes a major challenge with neuropathy and leads to a lot of difficulty in driving and becomes risky to drive. Second thing is, when you are pressing your feet too hard, there is change in the architecture. There is change in the bone vascularization, and there can be pathological fractures in feet because of the Charcot foot or abnormal posturing, which can further complicate the situation. So one moral of the story is, you have to keep your sugars under good control. If you keep under good control, you can prevent complications and you can prevent all these things. If you are having complications, again you have to make sure try to curtail them by having good control. Take all the precautions when you are driving. You should not drive if your vision is compromised. Suppose your eyes get damaged, you get early cataract, you will get blurry vision. More important is, you can have retinopathy, damage to retina, and you may have defects in the visual field. So it's part of the field you may not be seeing, and you are likely to cause accident. So all these things are there with diabetes complications also. Foot is particularly very important because you are controlling the vehicle with feet. And eyes is also very important, because if you don't have regular vision, proper vision, then you become more prone to get into accidents.
We should be very careful if we have any of
Yes,
these
so that is
complications,
why
or
it
we
is
can.
very important to
Mhm.
make sure that you are monitoring your sugar, keeping it under control. And it is recommended for all diabetes patients to get their regular checkup for all the basic parameters, as well as complications like foot evaluation, like evaluation for neuropathy, foot circulation, fundus examination. Everything should be done every year for all these patients.
Right, sir. So, would you like to add anything else?
So I think these are very important things. And second important thing is that person should know that if you have a limitation, you must avoid driving. People don't take it seriously, but you have to understand that if you have a limitation, either because of the medications or because of the complications of diabetes, you should avoid driving. You have all n number of options. You can take Uber, you can take Ola, you can tell somebody in the family to drive. You don't need to drive yourself, because it can be dangerous, it can be risky. Second thing is, most of the people, despite telling them, don't check their sugar before they start driving, before they go out. So that should be a basic thing that should be followed by all the persons with diabetes. Third thing is, they don't carry glucometer. So they should carry glucometer with them. And they should not hesitate in checking sugar whenever there is slightest problem. Another important thing is long drives. People would like to go to long drives. But again, checking, nobody knows what the sugar level is. So if you are on a long drive, certain precautions are: first, you must check your sugar before you start driving. Second, make sure you have taken your medication and meal on time. Third, during driving, make sure that you have a small snack every 2 hours or 3 hours and take your meals on time. And also keep checking your sugar every few hours. If you have slightest problem, check your sugar again. Take a sweetened drink. Make sure that during that long drive, you don't end up with low sugar at any point of time, which can make not only your driving risky, but all the people who are going with you are in dangerous situation then. So all these precautions are very important for every person with diabetes who wants to drive and wants to go for a long drive.
So what we mean to say, dear friends, is that patients who have diabetes, they can drive, they can enjoy their life. But before going for a long drive, you need to be prepared, and you need to really prepare yourself for these small little things which sir has pointed them out.
I think it is very important area, and it is a must for everyone to understand these basic things before you start driving.
Right,
So with
sir.
this, we can conclude this session.
Yes, sir.
And hope this information is of it will be of use for all of you, and we'll come with something more next week again on Thursday at 3 p.m.
Thank you,
Thank you.
everyone.